coming. My name is Amy Luckowitz. I am the director of the Drug-Free Communities Grant for North Reading. And in town, I coordinate our Youth Substance Use Prevention Coalition, which is the main driving force behind Nicotine-Free Generation campaign to educate and see if this is something that the town wants to pursue. So thanks for having us. Thank you for coming to a day session. This is our third session, our third public information session. It'll be our final public information session. And I'm going to turn it over to Marcy Bailey.
Hi. Thanks to everyone for coming. I'm Marcy Bailey. I'm a longtime member of the town's Youth Substance Use Prevention Coalition and a long advocate for the youth in North Reading. We're going to tell you a little bit about NFG, why we think it's important, and some statistics and information about the harm that nicotine causes to young people, and a little bit about what's happened throughout the state so far on NFG. I'm driving here today. I heard on the news, and I thought this was really apt. Today is the Great American Smokeout. And we don't hear about that so much anymore, but from the American Cancer Society, you all probably remember that, and it's still there. Although smoking rates may be down, nicotine and tobacco are still doing harm. Only a few cigarettes, and we don't know yet, but we can extrapolate out years from now what the science will show. A few vapes can increase the potential for cancer. And so our goal is to stop it before it starts, to keep youth healthy throughout their lives. So as an overview, well, I guess I'll start with a question that I'm asked before. At what age, if you have a young person in your life, at what age do you think it's a good idea for them to start using nicotine? And for us in the coalition, the Prevention Coalition, our answer is very clearly no. And what we're going to do is really tell you why. So to start about NFG, and I know there are many experts here, but some of you who may not be quite as familiar. NFG is a policy that's right now being implemented at the local level in Massachusetts, and it ties the ability to purchase nicotine products to a date certain rather than an age. So for example, if a policy is enacted on January 1st, 2026, anyone born after January 1st, 2005 can never buy nicotine. It's an incremental phasing. So anyone who has the right now or before it's enacted to buy nicotine will always have that right. But as the next group of 21-year-olds turn 21, they won't be able to buy it, nor when they're 22 or 23, hopefully preventing lifelong addiction. It won't prevent internet sales, but it reduces the likelihood that youth will use based on local access. They wouldn't be able to walk into a store in North Reading. A 21-year-old wouldn't be able to walk into a store in North Reading and buy a nicotine product for cash. Or a teenager maybe with a fake ID, though Amy works very hard and they're less and less. But it just incrementally takes away that chance that they're going to become addicted. And it's part of a primary prevention model that we work really hard on, and Amy's the expert on that, so she's going to tell you about that.
Thank you. Before we continue, I should have mentioned that this session is being taped by NORCAM over here, so if you would like to speak at the end, I'd just like to everybody know you will be on camera. Okay. So as Marcy said, our focus is on primary prevention. As a federal mandate through our federal grant, everything we do has to be focused on primary prevention. So I wanted to kind of clear that up of what that is. So primary prevention is an action that tries to stop harm from ever happening. When you wear seatbelts, when you wear helmets, that is preventing at a very primary level. But there's other levels too. So secondary prevention is action that focuses on early detection. Things like mammogram screenings, early intervention, we're all very familiar with those things. And tertiary screenings is prevention that focuses on intervention to slow or stop harm of the disease. For example, tumor removal, wearing things like masks, and substance use treatment, which is something that is obviously a big part of what we do. And it is extremely important to understand that this very complicated diagram here. And what it does is it shows harm minimization through nicotine products, where on the far right side it shows the harm related to cigarettes. No surprise there, has level of extreme toxicity. But on the far left, obviously you don't use, there's no harm related to nicotine. So that's really a great example of what primary prevention is.
So NFG has had a brief but very active history in Massachusetts. So cities and towns have been working on it for about 6 years. It's also been proposed at the state level, though we know that the legislature moves slowly, and the legislature also counts on cities and towns to sort of direct them to what the people of Massachusetts and the communities want. So it's very important for NFG to start at the grassroots level. Brookline, as it says on the slide, was the first to enact NFG in 2020. The regulation was challenged in court and it was upheld. Since then, many other communities have pursued NFG, and NFG banning nicotine for age 21 and older as they turn 21 is not really a completely new idea. There have been bans for public health reasons for lead paint, lead gasoline, and asbestos. In June 2024, the North Reading Prevention Coalition unanimously voted to pursue NFG, to advocate for it, and since then we've been working with the community and the Board of Health to educate and get feedback, educate the community and get the community feedback. So we have some exciting news since we were here last time. I think Mr. Hunt, who has listened to this presentation a few times, may notice that in the first presentation it said 17 cities and towns in Massachusetts had adopted NFG. Since then we're up to 19. Recently the town of Dover and South Hadley have enacted, so it's moving along, and there are two ways that NFG can be adopted. One is by local Board of Health regulation, and the other is by a general town meeting bylaw. It's important to note that 18 of the 19 communities that have enacted NFG have done so through Board of Health regulation. The only one in a general bylaw is Brookline, which enacted it by town meeting, but an important distinction between North Reading's town meeting and Brookline's town meeting is Brookline has representative town meeting, where representatives represent, not to be redundant, different neighborhoods and become more educated on issues as opposed to open town meeting in North Reading. So we'd like to talk about kind of the players here. The first is what I'm here representing today is the Youth Substance Use Prevention Coalition. We're funded by a federal grant, and our charge is to prevent the use of harmful substances among North Reading youth. And again, prevent is key, as Amy talked about primary prevention. We don't want them to ever get started, because once addiction happens, it's just it's such a challenge for those struggling with substance use disorder and for their families. The Community Impact Team, which is the umbrella organization of which the Prevention Coalition is a part of, has worked for many years in North Reading to make the town a healthier place, a healthier, safer place for all our residents, from young children to senior citizens, and to look to solve underlying problems, of which nicotine use among young people is one of them. And finally, the Board of Health, and as I mentioned, the Board of Health is the regulatory body who could enact NFG should they so choose, and we appreciate Mr. Hunt and other Board of Health members being at these meetings to learn more and to hear the input. But one, as you can see on the bottom line of the slide, one of their key roles is tobacco control programs, and this would fall under that. And the Board of Health has a strong history in North Reading of protecting youth from tobacco products that might harm them. So Amy's going to talk a little bit about why NFG is a great way to go.
Thank you. So why are we pursuing NFG when we know that there's so many great tobacco and nicotine controls in our state? Mr. Borgard is here. He's our representative for the nicotine control kind of program that we have in North Reading, and he's done a great job with help us prevent access to young people. But it's still an issue. Smoking is still the leading cause of preventable death. The other day, I was in a store and I noticed the sign on the door, and I'm sure many of you have walked by it a ton of times, and it stems from a 2006 federal case. And the result of that federal case is federal court had ordered R.J. Reynolds and Philip Morris to put this warning on retailers. So I wanted to share this with you because it caught my attention more than ever, and I'll read it to you first, but I'll pass this around. And the warning that is required to be on the door says, more people die every year from smoking than murder, AIDS, suicide, drugs, car crashes, and alcohol combined. And I thought that was just a really good summary of that exact first point. More than 80% of smokers start by age 18, virtually all by 26. And I'm sad to say that data shows that in North Reading, most nicotine users start younger than 18. This past year, the age was 17. The year prior to that, it was 16. So we are heading in the right direction, making that age get older. But in North Reading, it is about age 17, and that's from kids self-identifying their own age of first use. The tobacco industry has been shown in court to utilize a marketing playbook and produce products that entice young people to use. That is a result of that. That's one example there. I also just recently got back from some international travel. And all the court cases that sometimes come up about this, in international arenas, it's very different than in the United States. I'm going to pass a couple of these around too. In the United States, we do have to have warnings because of things like this. But in other countries, they're very more stark. For example, this product is not risk-free. It contains nicotine, which is addictive. The other ones, I'll let you guys read these, but it says smokers die younger. I mean, they're much more stark in other countries than they are here, and those are all because of lawsuits that happened. So these are images that I took specifically abroad. New products like salt nicotine and nicotine pouches create a more comfortable way to consume high nicotine products. I am not going to pass all of these around. If you get a minute after the presentation, I encourage you to come up and have a look at some of the products that we have taken from North Reading students. I'm going to pass this one around. These are nicotine toothpicks, which I'll talk about in just a second. But I really encourage you to come look at this, and I'm going to highlight some in just a second. My point of this is that I like the term nicotine-free generation versus tobacco-free because we don't know what the next thing is going to be after nicotine salt and nicotine toothpicks. But I know there's a billion-dollar industry out there who is working on that next thing. Our aim is to prevent the addiction of nicotine. If we remove the market, it really won't matter what that next thing is because we won't have kids using it. I do want to highlight that this is a gradual change that minimizes our impact. We have 10 retailers in North Reading, and that is something that both the Board of Health and the Coalition was sensitive about. At their direction, I went out and had one-on-one conversations with all 10 retailers. Mr. Patel is here from Christopher's. He and I talked about this probably 3 or 4 months ago. And it was really interesting to get some perspective on that, and I wanted to share some of the outcomes of that conversation. The first was that Big Tobacco had already been there for most of the chain stores. Things like 7-Eleven, Joe's Quick Mart. And what I learned in those conversations is that they were misinformed. Big Tobacco had already been there and told them that this was prohibition, that they would have to rip all their products off the shelves the next day once this goes into effect, and that's just fake. That's not true. It's not true at all. And so having those one-on-one conversations with those retailers really eased some of their concerns. And also I talked to them about how this is going to be a very gradual change. You have time to adjust your business model, but also nothing is going to be ripped off the shelves. It's not prohibition. Those who still have, or those who are able to purchase will not lose that ability to purchase. For the retailers that lived in North Reading, I had a very interesting conversation. Those who were parents said, as parents, I am fully in favor of this. As a retailer, I don't really mind it because I'll be long gone by the time this really impacts my business. I was not expecting that answer. I did not expect that. But the last thing I learned is that North Reading tobacco income represents a very small percentage of most retailers' income. So because North Reading does not have any tobacco or cigarette stores specifically, no small business is going to be wiped out because of this. Oh my gosh, to really be up on it, huh? There we go.
So I could do a page down.
Yes, yeah.
There you
So I'll
go.
bring them all up. All right. So I wanted to show a couple of the products that we're concerned about. And again, hopefully if there's no demand, the next thing won't really matter. Zyn is a very, very well-known common nicotine pouch. Some retailers in North Reading are having a hard time keeping it in stock because it's so popular. You might also see On or Velo. When I was traveling, I was seeing these being sold very cheap. In fact, 5 containers of Zyn in one location international was going for just $30, which brought it to about $6 a tin. Very cheap, taxed differently. The other thing is the nicotine toothpicks, which is the one that gets the parents the most attention. I think I passed some close-up pictures of that. Very discreet, very easy to not know what's going on there. And the last one is, I will pass this around. I should say, that these are hard to buy, but I did get my hands on one. This is a highlighter vape. As I pass this around, you'll be able to see the charging point, this is a real one. This is a real highlighter. The one on the bottom is the vape. It fell out, and I don't want to open this up to put it back in, but this is a rubber tip that goes in there, so if the cap is off, a school teacher, a parent would not know what you're using. It looks like you're just biting on a pen. That is the mouthpiece where you would vape from, and these are all flavored. 100% of these are flavored. This one in particular, I think is tropical peach. But if I had them next to each other, it wouldn't really grab attention. I will pass this around. I've been asked, does the cap fit on it? The cap does fit on it. Looks just like a real highlighter. But the cap doesn't, this might be a design flaw. I don't want to say it too loud, but if the rubber tip is in it, the cap does not fit on it. It'd be very difficult to educate parents and teachers about keeping up with all these discrete items. Our friend Maureen over here has provided us with some of the other additional kind of fun, toy-looking products, and what I can tell you is that we've done some education at public events like National Night Out in North Reading, Applefest, and 9 times out of 10 the kids go immediately to one of the 2 boxes. And they'll be like, oh, what's that? Literally proving my point that it is made to attract kids. And the parents will come over and they'll say, what is that? And Marcy will say, did you see what just happened? The kids went right to it. And we see that all the time. Again, at the end, we're not going to go through all these, but please come up and have looks at them. I do use some of these in our education. Detective Lucci and I go out to the schools. One of the things that we do talk to the kids about is marketing and how it's targeting kids. This is a juice box, but it's fake juice. It even has a fake straw on the side. So we walk through this box with the kids and talk to them about all this. So why NFG in North Reading? And I find it very, very important that we talk about local level stuff. And do kids in North Reading even need this kind of protection? So every April, every spring I'll say, we take what we call the core measurement data. It's federally mandated for our grant. And one of the questions that we ask is about tobacco products. And we report on past 30-day use. So the numbers that you see are real kids in North Reading grades 6 to 12 who answer this. I want to walk through this because these are questions I get asked all the time. We checked the margin of error. The margin of error on average for this particular year was 5.33%. That is a very good margin of error. As I describe it to the kids, I'm sure you all know what it is, but my word, I always say, it's the wiggle room. It's the wiggle room there. So I say that because kids say to me, do you think they're being honest? No, I don't think 100% kids are being honest, but I don't think kids over-report something that they aren't doing, if that makes sense. So you can use that margin of error. The other thing is the confidence level, and that confidence level is pretty standard at 95% over the past 10 years. We're pretty happy about that. As you can see, we've had some change, but we do check it with tobacco, vape, and any nicotine pouch. We started tracking that number last year when we started seeing kids pop the pouches in their gums, and that's something we're keeping a very close eye on. I will mention too, by the way, in case you want to guess what the next thing we're tracking is. Any guesses, any behaviors? Online gambling. So although it's not substance related, that is a behavior that we all see kind of connected to addiction. Some other data locally. In North Reading, students in grades 6 through 12 self-identify the median age is 15, and the age of tobacco products is 17. Again, that's younger than the national average of 18. It is a complementary action to the Board of Health's efforts to reduce available retail locations called outlet density. That happened last summer. It's going to complement that Board of Health effort. It includes all nicotine delivery products, again, staying ahead of any future products that big tobacco might come out of. And that to me is really a key point. We can't understate that one enough because it's nicotine-based and the policy addresses nicotine addiction, not just tobacco or cigarettes. Very important. And most importantly for the coalition, it is a great example of primary prevention. It is our main goal to stop. In this case, we're not trying to necessarily stop cancer from cigarettes. We're trying to stop the addiction of nicotine, the disease of nicotine addiction. Excuse me. Okay.
Okay. So we're nearing the end of the presentation. I'm going to go over a few FAQs, but first on a personal level, I think I have to say that I did staff the coalition table at National Night Out, and I was amazed at how good big tobacco is at their job, because kids ran right over to the table, picked all this up and said, you know, what is this? How do I get it? And it gave me an opportunity to explain that to parents, but it also showed me, my kids are older now, how easy it is to market to kids and draw them in. And again, shudder to think of how many times in my own household I picked up a highlighter off the floor and handed it to them or put it on their desk and didn't take a second look at it. And that just harder and harder for parents, I think, and we want to help them. So on the questions that we have, the first one is, does it take away free choice for adults or infringe on personal rights? And again, anyone who currently has the ability to purchase a nicotine product will not lose it. There are other examples, as we've said, lead paint, asbestos, the legal requirement to wear a seatbelt, that don't take away personal rights but protect public health. And we know that tobacco, as Amy outlined, has been one of the greatest detriments to public health and a huge cost for public health. When we see health insurance premiums go up, in part, that's in no small part because of the treatment and the testing and treatment required for cancers that can be caused by tobacco. So the next question, will people buy online or over the border? They may. We can't prevent that. North Reading, we don't want to be over the border, and I think we're going to hear from and meet some of our neighbors today who have some experience with NFG. We don't want to be there over the border. North Reading has a long tradition of caring about and protecting youth health, and this will continue that. So next, it's not like prohibition, as we had said before. It's not taking away the right to buy a product that many people enjoy the right to use now. Adults who can use it will continue to be able to use nicotine, and there will be little economic incentive for that reason for a black market, which is what happened in prohibition. We don't expect that to happen here. Youth cigarette use is down. Is it necessary? All we have to do is look at the table here. And we couldn't have maybe imagined these products 10 or 15 years ago. We can't imagine what's coming next, but you can be assured that there's some R&D of big tobacco looking for the next thing. So banning it at the nicotine level, it won't matter what the delivery system is. It will protect youth going forward. The next question is about tax revenue, and Amy is very well versed on that, so she's going to answer that for us.
Sure. Let's see if I can get the, oh, it's on a delay all of a sudden. All right, we'll see what happens. This was quite an FAQ. By the way, these all come from the public. These are the most frequently asked questions that I've got being out in the community. This tax one came up so often, and I think it's because of the climate with fiscal responsibility right now, and I wanted to address that, but I didn't have any clue about how tax revenue was going to be affected. So did some investigation, talked to the state, talked to our own town treasurer, as well as our state reps. So I wanted to explain how that works, and I did have a graphic that's not coming up. When North Reading takes in $1 of nicotine revenue, that dollar goes to the state's general fund. Now, what is the general fund for the state? That is how they give back town aid. So if the question is nicotine reduction going to lose, are we going to lose tax revenue in North Reading? The answer is kind of. However, it can't be quantified. So that amount that comes back to North Reading in the form of town aid, not only does it vary, but that dollar would have to get divided up by the 351 Massachusetts cities and towns, so it's not coming back as $1. Also, because North Reading is relatively affluent, it doesn't come back proportionately. It also doesn't get sectioned out, so I asked the town treasurer to look at our last few receipts for town aid, and it doesn't separate it out. This is how much came from alcohol revenue, this is how much came from tax revenue with nicotine. So I wanted to clear that up. And I think we all can probably agree that the amount of the money that comes in from tax revenue related to nicotine is far outweighed by the public health costs, even if we just take out insurance alone, is far outweighed. So I'm sorry the graphic's not coming up, I'm not sure.
Yeah, I tried.
Yeah, I don't know what's going on. I broke it.
Okay. Well, whether or not we can get to the next question on the screen. Okay. Well, okay, there we go. So an important question, one of the most important, I think, is how does NFG stop nicotine use for current youth? And one thing that we know through the core measurement surveys is the way that underage users of nicotine get their nicotine is from older siblings or older friends. So if you think about it, if you're a freshman in high school and you meet a senior, and then they, 4 years later, are age 21, and you're a senior in high school, or 18 or 19, a freshman in college, they can then, at 21, they can purchase nicotine pouches, any nicotine product, and share it with you as an 18 or 19-year-old. You might have a 14-year-old sibling, and you might share it with them. You might like how it feels. You might be addicted to it already, that's how it happens. So preventing 21-year-olds from buying nicotine, and then when they turn 22 and 23, widens the gap between those permitted to purchase nicotine and youth teens, middle school and high school age, till they really don't know anyone, hopefully, who will buy them nicotine anymore. So it's a phase-in, and Amy talked about the reasons, but that's an important distinction, the gap that's going to grow between those able to purchase nicotine and younger teens whose brains are so susceptible to addiction. And we have just one more question, and then we're going to wrap up.
I would like to take this one. Why aren't we also dealing with alcohol and marijuana? The coalition is very apt at walking and chewing gum at the same time. Few things for this. I encourage everybody, if you go on to the CIT website, it's northreadingma.gov/CIT, and you click on the tab that says data. We've been tracking several substances, so very specifically alcohol, marijuana, tobacco, and prescription drugs. We separate vaping and tobacco out separately because for us it's two different behaviors. But we've been doing this for 10 years. We've been very successful. I'm very proud of the volunteers of the coalition. If you go on that data website, what you're going to see is a couple of things. Overall, and I brought a couple of examples, I think, over here near Susan. I'll grab this. So this is just the past 30-day use. So since 2023, we're down 15.21%. We track this for each of the substances, including marijuana and alcohol. We are down across the board. You'll see some spikes related to COVID and marijuana legalization. But because things are legislated and monitored differently, we have to take them kind of drug by drug by drug, substance by substance. So although we're here talking about nicotine, I want to assure you that we are also addressing underage alcohol and marijuana use, in addition underuse and misuse of prescription drugs. So Coalition has been doing this for 10 years. Very proud of the training that they have, the knowledge that's within the coalition, the specialists that are within the coalition, and we do work on that very closely. I don't want anybody to think that this is a target just on one substance. It's not at all.
Okay. Thank you.
Sure.
So to wrap up, we want to talk about the coalition's vision. We talk about our aim and our charge and our mission is primary prevention. And our vision is really a world where young people think it's strange to use nicotine. They don't see their friends do it. They don't see their siblings do it. The way we could maybe, those of us old enough to remember, could not have imagined maybe firstly going to a restaurant that was, let alone smoke-free. You had to ask, do you want smoking or non-smoking section? Now if you brought your kid into that, they would say, what are you talking about? The plane? Do you want the smoking section of the plane or non-smoking section? We want our kids to think that that's as strange as it seems to us now. And we are, again, thankful for the Board of Health in endeavoring the learnings and the listenings on this. They've been certainly a vigilant and key advocate for public health in North Reading, and we see this as a continued part of the process, and we welcome their partnership. So to wrap up, again, the question I started with, as a community, at what age do we think it's okay for youth to be permitted to purchase nicotine? Youth or young people? To me, 21, 22-year-old is still youth. Their brains are still developing, and our answer is never. And we want to be a leader. We don't want to be the neighboring town where where young people come to purchase nicotine. So we want to thank you for coming. We're going to open it to comments from all of you who took the time to be here today. We'd just like to note that we're here to listen to all points of view. We would ask that you keep your comments to a few minutes. People have to get back to work and other things to get along with their day. So we want to be cognizant of that. Again, the NORCAM is recording the comments, and we ask that you step up to this microphone. It's a small room, and I know we can all hear each other, but Rob from NORCAM, who is another great partner from for the coalition, is here recording and is going to share this on their channel. So if you could come up to the microphone, that will make the quality of their recording that much better. We did have a sign-in sheet, so Amy is going to read the names and ask you to share your comments, and Amy will also share a few comments that we've received in written testimony from people who could not attend today. So again, thank you for coming, and we will look forward to hearing from you.
Thank you.
And Amy will do the calling.
If you came in and you did not sign in, but you still want to speak, there'll be an opportunity. I'll ask if anybody else wants to speak. There is an opportunity to submit online testimony if you'd like to do that. There's the QR code to do that, but just asking just to kind of wrap up this campaign, if you could submit it by December 1st. I have to point out, this is most important, we know there's the chance that everybody in here knows somebody with an addiction. Laura Miranda is back here. You may want Laura. Laura is our full-time mental health and substance use clinician for the town. I put this on every presentation we do. If you forget my name, if you forget Marcy's name, please remember Laura's name. She's available phone or email, and she will connect people to help. Okay. So Maureen from Melrose, we have you up first, please. By the way, I'm going to leave this up during the duration of the presentation, so if you want to take a picture of it, please do. Hi.
Good morning. Maureen Busby, Regional Tobacco Prevention Program Coordinator for communities just south of here, including Reading, Wakefield, Melrose, Malden, Stoneham, Winchester. I hope I didn't leave somebody out. I wanted to mention everyone who has spoken, thank you very much so far, has talked about the harms of tobacco and even a little bit about the financial impact. But in addition to health harms, financial impact, and potential missed career opportunities, which does happen sometimes if you're a nicotine user, like not being able to join your local police force. Nicotine products also create the most common litter around the world. In fact, the most common litter around the world is a cigarette butt, largely made of plastic, polluting our planet. Nicotine itself is a poison, so every product that is discarded, whether it is a cigarette, a cigar, a vape, or an oral pouch, we are depositing a poison into our waste stream, onto our streets, and in our parks, playgrounds, wherever, and thus into our wastewater. The metal coils in a vape device contain toxic, cancer-causing metals such as cadmium and nickel. Lithium batteries are highly volatile. And of course, when you use a vape device, you are aerosolizing an oil that has been treated with many chemicals for aroma, color, and flavor. And then you breathe that aerosolized mist, that oil mist, into your lungs, where it clogs the small airway passages and causes irreversible lung damage. Thank you.
Thank you, Maureen. And it occurred to me as you were speaking, I might turn the microphone around.
Yeah.
So you're facing the audience. Sorry, Rob, if this messes up the camera shot.
That's okay.
That makes a little
Oh,
more
you want
sense.
to
Okay. Mr. Patel.
Good morning. My name is Prashant Patel, and I'm North Reading resident and also a business owner. And first of all, to purchase any of these products, 21, you're adult. Anytime you do any crime, 18 to 21, right?
Depends on the crime. Yeah.
Yeah, so they count
I'm
you
not
as
sure
an
what we're talking
adult.
about, so.
Yeah. And a lot of the product I see here seems like it's flavored, and Massachusetts has banned the flavor in 2019. So none of these product is sold in North Reading, I think.
Correct. Yep. No flavors in North Reading.
No, I mean, I don't know if, when you guys complicate it, I had a question.
I'm
So when
sorry.
you guys catch these products, do you guys follow up where they're buying these products from?
Yes.
Do you, okay, so what they're in
Online and from older siblings.
okay.
Mostly.
And
Mostly.
Mostly from out of state, right?
I can't answer that.
No? Okay. Also with the sign, this was proposed by federal when the case was pending, but it's not required anymore from the state. Did you know that, right?
That it wasn't required by the state.
While the case was pending, the federal court had all the retailers post this sign at the door.
Yeah.
That they're not required anymore.
Okay.
And majority of this nicotine-free generation, it's not gonna stop the product from out of state, you know. And it seems like it's coming from out of state and online, you know. So if you ban it at the ground level, we keep eye on who's buying, you know, catch sometimes kids comes up to the stores and get a fake IDs, and we catch the, we hold the fake IDs, and we tell them, like, like, so they don't come back, so we stop them at the ground level. And a lot of the products I saw on the photo, like nicotine pouch, it was saying flavor on the photo, and Massachusetts doesn't have flavor, so most of the products, like tobacco and vapes, whatever state requires, we sell it. If towns comes up and say, don't sell these products, we take it off. Simple as that, And that's what I wanted to say, Thank you.
Thank you.
Thank you.
Dr. Lopez from Reading.
My name is Richard Lopez. I'm a resident of Reading and chair of the Reading Board of Health. And I'm a retired primary care physician and physician executive at Atrius Health. So I'm here to talk as a physician who's cared for patients who've suffered the ravages of lifelong addiction to nicotine, as well as a Board of Health chair. And we led a successful implementation of the Nicotine-Free Generation in Reading in the first part of last year, approved in June and went into effect in January of this year. I wanted to share my experience really from the Board of Health perspective of going through the process. And the presentation took a lot of wind out of my sails because we covered a lot of the points. Although at the time, and this is an extract from my vote at the board meeting in June of last year, at the time, a lot was coming at us. I had probably over 200 emails of various types, often from retailers, associations, and so forth. We had, positive feedback as well. We had public hearings that went on and on and on. And so it was a pretty active process. And the way I looked at it was there were really three aspects to the issue. One is, what does everybody agree on? Secondly, what are things that we can't predict the future of if this policy was implemented? And thirdly, the whole issue of the role of the board and personal choice as an adult. On the first point, actually everybody agreed that nicotine and tobacco causes death, disease, heart attack, stroke, multiple cancers. And everybody agreed, and even the tobacco industry, that we shouldn't be selling these products to people under 21. So we actually had this small piece of common ground. The second piece was a little bit harder. That is, how do you predict what's going to happen as a result of this? And there were really two major issues, or two major points. One was, what was going to happen to the retailers of tobacco and nicotine products if this happened? And, it was sort of the sky was falling, and, just like when in the state, legal age went from 18 to 21, that was going to cause a disaster. It didn't. But as pointed out in the presentation, this is very incremental change. It'll be a decade before there's a significant decline in the customer base for these products. And there ought to be innovation in the retailers to figure out how to make up for that. And in fact, in Reading, of course, it's only been 11 months, but there haven't been any retail closures at all. And we haven't really heard back from tobacco and nicotine retailers that there was a problem. The second issue that was unpredictable is, how would this impact the underage use? And as pointed out, there's really three ways adolescents get access to nicotine and tobacco products. One is through their social circles, family, friends. Second, through the black market, adults sell them. And thirdly, online. Well, it's only going to affect the first, as pointed out, it's only going to affect the first issue, as over a decade or two, their social circle will also not be accessing these products. In Reading, our survey showed 8 to 12% of Reading middle school and high school adolescents using tobacco and nicotine products. And so that represents about 100 to 200 children and adolescents. And in my mind and in our board's mind, if we can prevent even a fraction of those 1 to 200 from a lifelong addiction to nicotine, it was worth the effort. So the third area that, as I broke down the arguments, was the whole issue of the role of the government, the role of the board, and personal choice as an adult. And in terms of the role of the board, as mentioned here, some people said, well, this is an overreach of the Board of Health. And as pointed out, the Massachusetts Supreme Judicial Court in March of 2024 stated it wasn't, and quote, the bylaw is rationally related to the legitimate government interest and does not violate the equal protection of Article 1 of the Massachusetts Declaration of Rights. So this issue that it's an overreach is not supported by the Supreme Judicial Court. The second sort of argument in this sphere was, this is a slippery slope. And we heard a lot of arguments in the public comment about what is called reductio in absurdum or whataboutism as arguments against this. So reduction in absurdum is, my favorite one was, next thing you know, they won't be selling Twinkies and ice cream to obese people. They'll prohibit that. So that's like taking something and bringing it to a point of absurdity. Or what about marijuana and alcohol? That came up in the public comments. I would say, what about cocaine, meth, and heroin? Why can't adults choose to use those? I'm not going to get into it, but these are rhetorical arguments that inflame the passions, but they do not focus rationally in the light of day on the issue at hand. So I'm going to move on from that. And then finally, this whole idea of personal choice as an adult. And here I have to question the concept of personal choice in the context of nicotine addiction or any addiction. When addicted, actually what I can say is studies have shown that, as pointed out here, that 8 or 9 out of 10 adult users started under the age of 18 to 21. So they started as teenagers or in middle school. And of those, 80% have tried to quit at least once or multiple times. This does not sound to me like personal choice. It sounds like individuals who are really addicted to nicotine, and they're trapped in that addiction against their free will. So, in my mind, at least, I couldn't buy this personal choice issue. So for me, the weight of the evidence was, and the rationale for the policy made sense. I supported it in Reading, and I respectfully recommend that this board do the same as a neighbor. Thank you.
Thank you, Doctor. Wendy?
Wendy is from North Reading.
Thank you.
My name is Wendy McGuire. I'm a North Reading resident, and I'm here to provide my support for the Nicotine-Free Generation. When I think about this initiative, I think about why not? Will it impact retailers in our community? Perhaps. But this initiative, the way it's laid out, it gives retailers years to plan for the change. It's not a day one impact for them, However, on day one, it does send a message to the kids. Nicotine's harmful to their health and to their wallet. It's aimed at protecting them and their future health and future expenses. It's helping parents to say no to nicotine. 19 other cities and towns around the state have enacted this initiative, and I think North Reading should be number 20. The toll nicotine takes on health is undeniable. Smoking is the leading cause of death and preventable diseases, which include lung cancer, heart disease, and stroke. And the cost isn't just personal. It is a burden on society as a whole. In the United States, smoking alone, smoking-related healthcare costs exceed about $170 billion annually, according to the CDC. But that's just the beginning. So I've thought about this in a different tact. Everything else that I've heard about this and in supporting it, but I have a background of 28 years in health insurance. So I worked in the health insurance industry, and I've seen the effect of smoking on health insurance premiums. And we're all hearing about health insurance today and the high cost. When millions of people continue to smoke, insurance companies increase the premiums to cover the higher cost of treating smoking-related conditions. And these premiums don't just affect the people that smoke, they affect everyone, they affect all of us. The average American family is already struggling with rising healthcare costs and being able to afford healthcare at all. With smoking as one of the leading causes of preventable disease, the burden is being passed down to everyone, regardless of if they smoke or not. If we can reverse the trend, nationwide it would be great. That's a big step. But it would be saving if 10% decrease in smoking or nicotine would save $156 billion in costs. It would reduce insurance premiums for all. It would increase productivity for people who miss work due to smoking-related illnesses. And it leads to a healthier population, leading to a better quality of life. The path forward starts with education. By teaching the next generation the dangers of nicotine and showing them the power of living free from addiction, we can begin to change the course of history. So let me tell you a quick story about my grandfather who died from smoking. He died 40 years ago. He smoked cigars every single day of his life. He drove an MBTA bus, and you were allowed to smoke on the buses back then. And he smoked cigars every day. When he had surgery on his lung to remove some of the pieces, the doctor showed my dad and my mom, who was a smoker at the time, the pieces of the lung and what they look like. Black and shriveled and pretty gross. So when my mom saw that, literally stopped smoking that day because she knew that she still had time to quit and bring some, health back to her. If kids could see the damage and understand what's happening to their bodies, instead of seeing these fun little vape pieces, they may make a healthier choice. Big tobacco makes it look like fun and makes it look harmless, and we know it's not. So this is a collective effort. It's our government, healthcare providers, schools, communities, families must come together to ensure that nicotine is no longer part of our future. It's about creating a society where health is prioritized over profits and where prevention is more valuable than treatment. Thanks.
Thank you, Wendy. Elizabeth Decker from North Reading.
Hello, my name is Elizabeth. I am a parent here at North Reading. I have little kids, but I'm also a Girl Scout troop leader, an attorney, and the wife of a 7th grade social studies teacher who works in Linfield. So I think I have a good perspective of some of the different reasons why I support this policy. Certainly from a legal standpoint, I think it's wonderful that Brookline has kind of paved the way for this and taken it all the way to the Supreme Judicial Court so that other towns don't have to fight that same battle, which can be costly, so that's wonderful. And as my kids are still really little, so they're less affected, but my husband does see this a lot in the middle school with the vaping, and his students are doing it, and it has a negative effect on them. Of course it does. When I see some of these toothpicks and things, that's alarming. Parents wouldn't even notice that. And I think it's something really sad that these 12-year-old, 13-year-olds are developing addictions before their bodies are developed, before their minds are developed. And if they saw, yes, the blackened lung, that would be horrific, but they still don't have that foresight, really. So even if they hear about all the negative effects and they know it can cause cancer, they're not thinking about that. They lack impulse control, really. So I think that it's really incumbent upon us to move forward with this policy. And Big Tobacco has adapted, and we need to too, because this is a different animal now. And I think it would be very short-sighted not to get ahead of this and take this opportunity to ban nicotine products, or not ban really, but institute this policy for these kids. So thank you for your time.
Thank you, Elizabeth. Jen Murphy from Winchester.
Hi, I'm Jen Murphy, the Director of Public Health for the town of Winchester, and I've come to lend my support to the community of North Reading and to let you know what's transpired in Winchester with the help of Maureen Busby, our tobacco coordinator, and our tobacco collaborative, which includes Melrose, Wakefield, Stoneham, Malden, Medford. Anyway, there's 6 of us, and we've all gone through this, and I'm going to just shed a little light from my perspective and my board's perspective. Our chair can't be here today. It's Dr. Greg Sawicki, but he was on the board when they adopted the NFG language, and he's still there today. And we started the process early, and I commend you for doing that here, because I think it goes a long way to hear from people in the community. People want to be heard about this, whether it's to voice their support or voice their opposition. I think that it, raises the topic in the community and puts everyone on fair notice that this is a potential to happen. So I think this is such a huge thing you're doing right now. And then bringing it to the Board of Health is obviously key. And I think what really tipped the scales for my 3-member board is not only the science, right? Obviously, there are no health benefits in tobacco and nicotine. In fact, there are a multitude of harms that everyone has talked about and is well known. So we have the science, but we also have the legal pathway that's been forged by Brookline, as has been stated. So that really was their pathway. Given the science, given the legal justification to pursue this, they sat back and said, okay, well, we were elected to oversee the public health of our community. So that's our role here, and that's what we need to look at through that lens, what makes sense. And they felt that adopting the nicotine-free generation language absolutely makes sense and is the necessary step to take. So in the fall of 23, they started the discussions just like this. By the spring of 24, they decided to have a formal public hearing, and not many people showed up, but everyone who spoke in favor of the adoption. It wasn't very controversial, to be honest with you. We were early adopters of this, but we got comments in writing of opposition from the Retailers Association, etc. And I think it boiled down to a lot of what Dr. Lopez said, harming retailers or personal choice. Those were the 2 main themes that seemed to come up. And again, the board kind of sat back and in their discussion said, well, again, we have the science here that says that this is harmful to our society. So we need to do the right thing here. And the next logical step was to adopt it. Our YRBS data looks similar to North Reading, so removing that option of choice from the up-and-coming generations, right, seemed the right thing to do. So they did adopt it, but didn't implement it until January 1st of 25, so gave a lot of time for retailers to modify their business. It was, enough time for them to see what was coming. And in fact, retailers said to me, we know the writing's on the wall. We know this is a dead end. We have to adjust to the times, right? So I think that helped, having all these conversations and getting the word out there early was really key to the whole thing. So, but I do want to thank Maureen, and hopefully Ron is, I've never met Ron, but Ron, I hope you're a great advocate for this around. On a personal note, I do live nearby, Ron, so I hope you're really spreading the word about this up in this area. Because there is comfort in numbers, I have to say. When we did it as a collaborative, many of us, surrounding towns did it, there was comfort in numbers, certainly. So I encourage others in this area to do the same. And that's it. Thank you so much.
Thank you. Thank you. Anthony Chu, Melrose.
Hi everyone, my name is Anthony Choi. I'm the health director for Melrose, Wakefield, and Stoneham. It's hard to go last. Lots of people have already said a lot of the important stuff. But I do want to emphasize that one thing that I want to bring up is that all of our communities, we've passed this policy now, and none of our retailers have shut down because of this policy. When we bring up the topic of loss of business, it's not a loss of business, it's no new customers of tobacco, of big tobacco. We don't want more youth to eventually get addicted, and we know from the science that brain development does not stop until 25. It continues through 21, and lots of impacts from nicotine can actually impact your decision making. Just to reiterate, a few speakers have already mentioned this, but the Mass Supreme Judicial Court upheld the lawsuit that was filed against Brookline in favor of Brookline, and said that it is a reasonable and constitutional means of gradually ending tobacco sales to future generations. Do we have any boards of health members here today?
Yes.
I want to say thank you. I have the privilege of working with many board of health members in our towns. It's a volunteer position, and why you do this is because you want to protect the community's health. We do this in public health because we don't have an agenda. We want to see the community be healthy, and we want to help be partners in protecting that. One of the things that wasn't mentioned yet today was the health equity portion of this policy. Tobacco disproportionately affects those, people of color, and those of low social economic status. It is a barrier to advancement. The amount of money spent disproportionately affects those and prevents them from moving forward. And the addictive qualities of tobacco is designed to keep those people from being able to quit and move forward. It's always cheaper to get these tobacco products. And so my conclusion will be that thank you to the coalition for bringing this important work. There's still time to be a leader in North Reading on this policy, and I'm hoping to see North Reading be community number 20. Thank you.
Thank you, Anthony.
4 letters of testimony were submitted, but before I read those, is there anybody else who didn't put their name in that would like to say anything? 4 people had submitted and asked me to read these aloud, and the first one is from Amy Friedman Lee. My name is Amy Friedman Lee, and I've been a resident of North Reading for 28 years. I'm a family nurse practitioner and have worked in primary care as well as a university health campus. Despite decades of progress, tobacco remains the leading cause of preventable death in the United States. Nicotine affects people of all ages, but is most dangerous among adolescents and young adults who begin using highly addictive pharmacological substances containing nicotine. Almost 90% of adults daily nicotine users start smoking by age of 18. Nicotine directly impacts the prefrontal cortex and impacts the brain's reward center. As nicotine stimulates the dopamine reward center, the release is significantly higher during the adolescent period. The adolescent brain is more susceptible to the neuroinflammatory effects of nicotine during this critical period of brain development. The neurotoxic effects of nicotine more profoundly impact structure, function, and connectivity of adolescent brains, placing adolescents at heightened risk of developing cognitive problems. Nicotine can negatively impact learning and memory, hinder the brain's ability to adapt, negatively affecting attention, learning, and memory. Nicotine can impact mood and behavior, attributing to mood swings, increased impulsivity, and contribute to other addictions. Nicotine does increase inflammation in the body and can lead to breathing problems, respiratory-related illness, and long-term lead to chronic disease, including hypertension, stroke, heart disease, certain cancers, and lung disease. The use of nicotine has negative impact on one's health. Clinically, I have seen firsthand these negative impacts. The rise in the development of chronic lung and other diseases at a young age can be prevented. Preventing today's youth from purchasing nicotine is a critical first step. In line with the Massachusetts Medical Society and Action on Smoking and Health, supporting legislation for making sure North Reading is a nicotine-free generation is investing in the youth of North Reading and future generations. That had a lot of high words there. Tough words for me. That was a tough one. This one is from Raisa Penny, and Raisa is somebody that I met at the North Reading Apple Fest, but she lives in Reading. And we had a conversation that she was concerned of her kids being in a nicotine-free generation community coming to North Reading to get nicotine. So she simply wrote, "I live in Reading and I support this cause." That's the backstory of that. Chris Tommen similarly is a neighbor in Haverhill, and he wrote, "I wouldn't want kids from my town going there to get nicotine." Deborah Mahoney from North Reading. "Let our kids be kids. There is no need to tempt them with items that are harmful and illegal. Youth have enough pressures in today's society. Let's erase some of those pressures. Where I have no personal experience, I have seen in others the destruction nicotine can do. Let's make a better future for our youth. I strongly support a nicotine-free generation." And the last one is a letter, and it's kind of lengthy, so if it's okay with everybody, I will submit this to the Board of Health in full, but it's very lengthy, and so
Good choice.
yeah, I'll read a piece of it. This is from Jeannie McDonald. She's a doctor from Melrose. "Dear members of the North Reading Board of Health, I'm a Mass General pediatrician and mother of 3 adolescent/young adult children. I am also just a few towns over, having lived in Melrose, Mass for more than 20 years. Both my mother and my husband grew up in Reading. I'm writing in support of NFG. The data on harm caused by combustible cigarettes is vast. Nearly 500,000 people die in the U.S. each year because of smoking combustible cigarettes. Though adolescents often try e-cigarettes first, 1/3 of them ultimately start smoking combustible cigarettes, thus putting them at immense lifetime risk of all the known diseases caused by smoking. Cigarettes kill half the people who use them long term. While we do not have the decades of data that we have on combustible cigarettes that directly link smoking to cancer and other diseases, we do know that nicotine plays a role in cell division and proliferation, both key components of carcinogenesis. Additionally, the aerosolized chemical solvents used in e-cigarettes have been shown to contain formaldehyde, acrolein, nickel, and cadmium, all known carcinogens. When inhaled, the aerosolized solvent particles from the vaporized nicotine solutions are immediately absorbed in the lungs and travel rapidly to the brain and other organs. We know that smoking is bad for the brain function. Long-term smokers experience cognitive decline thought to be related to narrowing of blood vessels and delivery of less oxygen. The brains of long-term smokers actually shrink. We now have emerging data that vaping also affects cognitive function. A recent study of college students showed that those who vaped had lower cognitive scores than those who didn't, and the more they vaped, the bigger difference. What is worse is that adolescent exposure to nicotine can lead to subsequent abuse of other substances, including alcohol, marijuana, cocaine, and opiates. Most concerning to me is the relationship between nicotine use and the opioid reward system in the brain. Nicotine use and opioid misuse occur together at a strikingly high rate. Nicotine exposure in a young person's brain has lasting effects on addiction and vulnerability for years to come. Nicotine especially primes the brain for addiction beyond nicotine. To say that a young adult can simply make adult decision and just say no to nicotine is unfair. No one chooses addiction. We all know someone who has loved one who is addicted to a chemical substance, whether it's nicotine or alcohol or opioids. These folks are not making an informed decision to use or not use. They know the substance is harming them. They want to quit. They just can't stop. In sum, e-cigarette use is not safe. Though the extent of the dangers of e-cigarette use are not fully understood, the data we have thus far is deeply worrisome. Young people are particularly susceptible to becoming dependent on nicotine very quickly, and this can have grave and lasting consequences. In just 7 years, from 2011 to 2018, we saw a nearly 20-fold increase in e-cigarette use by U.S. teens, with over 1.5 million youth exposed in 2018. This number is only increasing. While we cannot change the way adolescents and young adult brains are wired, we can limit their exposure to harmful substances like nicotine. We can educate, as my daughter's gym teacher has done so beautifully, and we can legislate. Passing the NFG regulation will save lives. It will save lives in North Reading, and it will in surrounding communities as other towns and cities adopt this regulation. I implore you to act on behalf of our young people, on behalf of our future. And I will add that she then submitted a lengthy list of supporting articles and studies on that. I'll send that in full to you. So this concludes our presentation, and thank you for the public input. I just want to say too, thank you to Gary, who's now heard this 3 times, and to the Board of Health. We appreciate your time and listening to all perspectives. It's really been a great community interaction piece, community involvement piece, and I think that's key to anything that we put forth related to public health, but also to the work that the coalition does itself, that we want the community involved. You've been a key partner in that, not just today, but for the past 10 years, so thank you very much.
I'm sorry, I just have a question. I know everyone probably has to go, but so you've had 3 meetings now about this. You've advertised it really well. I've seen it in the transcript on Facebook, and from what I've seen, I've been able to come to 2 of the meetings that it's been overwhelmingly supportive. And this is the 3rd meeting. When will the Board of Health make a decision on this matter?
I don't know.
Let me
Yeah,
speak briefly
sure.
here. I'm Gary Hunt. I'm the chairman of the North Reading Board of Health. I've been on the Board of Health for 40 years. So I know a little bit about the topic and other topics. We will have discussions. There's a 3-member board. Myself and others have been at all of the meetings. We requested these information gathering sessions so that we could be educated on both sides of the topic, pro and con. And I'm also appreciative of a number of other towns that have adopted the NFG to be in attendance, such as the doctor from Reading and lady from Winchester and other towns that we've talked with over the last couple of months. So we will have up-top discussions among ourselves, and then at some point we'll have a vote amongst the 3 board members, as we do for any topic. A motion will be put forward and a vote collected officially as to whether we were going to adopt it or not. So that's where we are, and that'll happen in the next couple of months. There's been a lot of information that's been received by our administrative assistant, Christine Doolin. I've seen most of that, but not all of it, so we want to review that, and we'll probably ask Marcy and Amy to come in and do a summation of what they've gathered. You know, I've seen all of it, but I haven't seen it all in one place. So we'll look at all that information, and it's a very exhaustive coverage of the topic, and we've got pros and cons, and we'll make a decision based upon the information that we have.
Thank you.
Thank you.
I appreciate that.
And when called upon, we are very ready with a nice organized binder for the Board of Health to review everybody's comments.
I knew you would.
Yeah. So I would just, as this is being taped, I would encourage everybody to submit their testimony. Even if you've read something today and you want it to be included again in the packet that we submit to the Board of Health, please send that to me. My email, or the coalition's email rather, is that Gmail account. You can again also do it using the QR code, but please send it by December 1st because we would like to wrap that up and get it to the Board of Health that afternoon, if possible. I'm going to see if that's a Saturday, but we'll get it if it's Saturday. If it is, I'm coming in. Thank you so much. We're going to stick around for a little bit. If anybody has any questions about what Laura does as well, please do so. But thank you for everybody's time. I know we have to wrap up. Thank you.
Thank you.